The team from Hawaii includes Kapi'olani Medical Services clinical geneticist Dr. Lori Seaver and Hawaii Department of Health genetics counselors Leanne Hasegawa-Evans and Jennifer Boomsma.
When people come to genetics clinic, we have to look at the whole body, and so we have to collect a lot of records, get a lot of history. We draw out the family history for sometimes 3 or 4 generations. We'll draw a family tree to try and see if we can figure out, what may be going on, and then again, the exam and the counseling that goes along with what the possibilities are, if this might be genetic, and if so, like Leanne said, we explain how it might have happened, whether it can happen again.
And when 2 carriers have children together, Dr. Seaver explains there's a 1 in 4 chance each time they have a child that child will have the genetic condition.
I see mostly kids with, like Dr. Seaver said, developmental delays, so just not learning as appropriately, I guess, as kids of the same age. Kids who grow differently than their family, so really big for their family, really small for their family. Just kids with any birth defects, so holes in the heart, or cleft lip and palate, anything like that. And what we try to do is figure out a reason or a cause for all of their symptoms or all of their health issues. So one unifying diagnosis.
Last week, the team met with 24 patients with genetic conditions.
We have about 24, and then plus or minus a few atoms. Just families that we've seen in the past that are coming briefly for follow-up or just need a quick update from us.
But most of our patients are new.
Most of them are new. We only have about 2 follow-ups, 2 to 4 follow-ups that we're seeing this year. So we get booked up pretty quickly.
Now her 6th visit to the island, Dr. Seaver says she's seeing some conditions unique to Guam.
There's a condition called Escobar syndrome, and that and it results in things like club feet and other joint contractures that are present at birth, and sometimes some webbing across the joints, some like skin webbing. So we've seen that several times here in Guam, and we see some different types of biochemical or metabolic diseases that can be detected on the newborn screen that they do on the babies, and we compared because we have some of the same populations like people from Micronesia and Hawaii, and so some of these things that we see in Hawaii we would expect that you would also see on Guam.
Health Check is presented by Island Cancer Center.